The Graduate School of Applied and Professional Psychology is relatively small, but it's mighty. It has innovation woven into its fabric as a tradition.
Our students are supervised and mentored by experts in the field, and they're often taught in the delivery of what are the gold standard treatments.
Together, we are collaborating to create a truly interdisciplinary research, training, educational, and service center.
We really want this to be a field that early career clinicians are impassioned about and actually seek out and pursue, and that's absolutely at the core of our mission here at the Graduate School of Applied and Professional Psychology.
One of the exciting new initiatives here at Rutgers is the creation of RU Cares, Rutgers University Center for Autism Research, Education, and Services. It's built upon the foundation of excellence in autism that the Graduate School of Applied Professional Psychology founded years ago. The university now is poised to create an unparalleled center in our state for integrating training, research, medicine, policy, all issues related to autism, and really help push the autism work in the state of New Jersey to the next level.
We serve school-age children and adults, and we work very closely with their parents to determine an individual program that will best meet their needs. We have two areas of training that we focus on. The first is in the area of psychology. We also collaborate with a variety of different health and medical professions. It is our hope that through those training collaborations we can create professionals who feel not only competent in their own discipline, but also in managing the individuals who are more severely impacted by autism spectrum disorder.
It was so crucial for the Rutgers Center for Adult Autism Services to exist within the Graduate School of Applied Professional Psychology, where our fundamental mission is on the training of future practitioners across numerous areas. We want to be at the forefront of creating this professional field of practice and building this workforce of early career clinicians and practitioners who want to specialize in working with adults with autism.
Our center is composed of 8 specialty clinics that are designed to serve a number of specific populations, including adults, children and adolescents, couples, and groups. We'll have additional clinical opportunities that will be piloted this year that serve immigrant and refugee populations, adults with autism spectrum disorders, and a clinic that specifically targets sports psychology. Our specialty clinics really provide to both the Rutgers community and the surrounding community the option of low-cost, specialized treatment that is sometimes really difficult to find.
The Center of Alcohol and Substance Use Studies is focused on trying to advance treatments for individuals in our communities who are struggling with opioid and other substance use problems. We have a national training program that has been established since 1962, and so our researchers and our educators are passionately geared towards trying to do innovative research and education to help our communities.
But New Jersey, unlike other nearby progressive states, doesn't have an academic center that is truly interdisciplinary that combines research, training, and education with service in mind to help develop the cutting-edge models for behavioral care, as well as to train future generations of psychologists, social workers, medical doctors, and nurses to help those in most need. To address these needs, we are initiating the Rutgers University Institute for Youth Social Emotional Wellness. 4 units at Rutgers are going to collaborate to create this truly interdisciplinary academic unit. We're hoping to transform how youth receive mental health services in New Jersey and beyond.
As agents of change, our school has used innovation to address a myriad of issues, whether that's addressing adults with autism, working with partners to build child institutions, or building programs to further the education of our nation's practicing psychologists. Innovation is not only key to establishing a competitive advantage, but it's also key in allowing us to be an agent of change and progress in the area of mental health care.